We are the American Lung Association, and our goal is to prevent respiratory disease by educating and promoting lung health to help the world breathe better. You might be familiar with the most common lung disease, asthma, which causes the airways to swell up and block air intake. It affects about 1 in every 13 people, but it is a temporarily reversible respiratory disease state that can be diminished with proper control.
Another major issue that you might have heard about is chronic obstructive pulmonary disease, or COPD. Are you over the age of 65 and have you smoked over 5 packs of cigarette in your lifetime? If so, then you're more likely to develop COPD. Even if you don't smoke, if you notice increased coughing in the morning when you wake up, or if you have difficulty breathing when you do everyday activities, then we recommend that you inform your doctor right away so you can be assessed for your likelihood of having COPD.
COPD is an irreversible progressive respiratory disease that is best managed when you receive a diagnosis and get treated as soon as possible. Those who have COPD are more at risk of developing other health problems. Therefore, it is essential to know if you have COPD to properly treat the disease and avoid other health issues.
Did you know that 5 out of 6 people use their inhalers incorrectly? It's not as simple as just putting the inhaler to your mouth and breathing in. You also have to make sure you take the right steps to ensure your inhaler usage is successful. If you aren't using your inhaler correctly, you may not only worsen your asthma by not treating it properly, but you'll also be refilling your medications more often and spending more money in the long run. In some patients, poor technique could even lead to emergency room visits. You can always contact your doctor or a pharmacist if you have any questions on how to properly use your inhaler.
Here are a few tips to help you use your metered dose inhaler better. First, you want to shake the inhaler. Make sure to prime it too if it's your first time using it to ensure that the medication is mixed properly. To do this, you have to shake the inhaler and point the mouthpiece away from you before pressing down on the canister a few times until 4 puffs are released. Repriming may be necessary if you haven't used the inhaler for over a week or if you dropped it, in which case you would need to release 2 puffs. Hold the inhaler with the thumb at the bottom and your index finger on the canister. Make sure you are sitting or standing up straight with your head tilted slightly back before administering the medication. Remember to exhale completely away from the device before putting the inhaler to your mouth. Wrap your lips around the inhaler and press down on the canister while you take a slow, controlled breath for about 3 seconds. Use a spacer if you have difficulty in taking a slower breath. Remove the inhaler from your mouth and hold your breath in for at least 5 to 10 seconds before you exhale away from the device, and then you're done. Repeat these steps if instructed to take 2 puffs per dose. If your inhaler contains a steroid, be sure to rinse your mouth with water after each use to prevent oral infection. You can tell if your technique is improving if you notice you tend to reach for your inhaler less often. When you are done, store the inhaler with the cap on at room temperature and make sure that there's nothing that can puncture the canister. You want to make sure to clean the inhaler at least once a week, and to clean this, you can clean it with a dry cloth, or you can remove the canister before rinsing the mouthpiece with warm water. Be sure to reprime the device after you have finished cleaning it. Finally, if you notice that you are using your inhaler to treat coughing fits or breathing problems throughout the day, let your doctor or pharmacist know so they can assess if your asthma is being treated properly.
Remembering these few steps and staying consistent with your technique will reduce the severity of your asthma, manage your COPD, and improve overall lung health. It is also important to try and live a tobacco-free life to promote overall good lung health.
Overall, the number one thing you can do to keep your lungs healthy is to look out for signs of difficulty of breathing and ensure you're using your inhalers correctly. Thank you, and we hope you take the time to look out for your lungs today.